This is work that is joint with Rohini Pandey at Harvard, I'm at Harvard, and Evidence for Policy Design. Yusuf Nigger is now at Michigan, and then Eric Dodge, who was with us at Harvard, who's now at ID Insight. And our problem statement and motivation is really driven by the fact that service delivery in developing settings, and I guess others can speak to kind of developed context as well, which I actually know less about. A defining feature is that it's hierarchical in nature, and I'll show you a figure that kind of illustrates that in just a bit. But this hierarchical delivery structure, which we see in the bureaucracy, and we're looking in India, can obviously lead to agency issues where there can be incentive misalignment and then also information asymmetries that are generated along the nexus of all these different principal-agent relationships or principal-supervisor-agent relationships, which have been modeled some in the literature. Yet an interesting thing is that now with the possibility of collecting data in new ways than we've done in the past, we have these digital data trails that were previously not possible, and they can actually address a lot of the information asymmetries that have been generated in the past. So our key question is, how should reforms that actually improve information about service delivery be deployed? And can these public sector reforms be more effective when we actually involve political actors as well? And the case that we examine is we're looking in India and its massive workfare program known as NREGA. I'm actually surprised I'm the only person here today talking about it, but I think that's a good thing. It reaches about up to 50 million households annually, spends $7 billion a year. And what happens is households that are rural, vulnerable, they can go to local leaders, request work, and then go work what's considered a work spell, which would be like a week or 2 weeks of work, doing some form of manual labor, unskilled work. And then after the work spell is completed, they're supposed to be paid within 15 days of working. In our study areas, the average payment, or time to payment, is 23 days, and we see a large standard deviation in that time as well after completing a work spell. So you can imagine if you're a rural, vulnerable household, you need cash right away, and yet you have to wait basically a month or more to get your money after working. This generates a lot of problems. It can reduce demand for the program or requests for work, and also, you may need to take a loan from a local leader, or someone has to pay you cash up front to actually spot you the cash from the wages. So there are lots of reasons that this kind of undermines the point of NREGA as a safety net in the first place. And to illustrate kind of the bureaucratic hierarchy that I was mentioning before, I just want to point you to the left-hand side of this figure here, which shows kind of the hierarchy. So first we have at the top a district office, and the district office is in charge of making sure that NREGA functions well at the local level. They oversee a group of block officers who are also then overseeing a group of local level employees who are actually implementing the work, inputting information into the management information system, and then sending this information back up the chain and requesting that payments are actually made. And the payment process itself, I'm not going to go into all the details of it, but the payment process itself is relatively complicated, requires a variety of different approvals and so on, and some trips to the field to measure works and all this type of thing after work has actually been completed. So the whole process in and of itself involves this hierarchy and is relatively complicated. So our research questions and hypotheses around this is, first we ask, can reducing information asymmetries by improving this monitoring ability of these higher level officials at the district level, can that be a complement to reductions in the cost of information acquisition for lower level officials? And what we're going to do is actually provide information to more senior officials and lower level officials, and this is like the study by Giancarlo and Erica, except we're varying information instead of incentives at these two levels. So our hypothesis is that management practices and then beyond that, the delivery of wages are most likely to improve when managers at different levels have better information. And then our second question is, can we improve service delivery by increasing information available to elected officials? And the idea here is that these local level officials are accountable to citizenry, and they can actually supervise the field level officials, the bureaucrats, who are supposed to be working on implementing the work and paying the wages themselves. So there are kind of a variety of different principal, supervisor, agent type problems that can be investigated here. And her hypothesis here is that improving this information or providing this information on administration to these local elected representatives will increase accountability and therefore speed up the wage payment process. The way that we deliver information is through a tool that we have developed with the Ministry of Rural Development in India. And the tool is known as Paydash. These are two screenshots. Paydash is an Android-based app that provides information on the payment process to district and block level officials. And the information that's provided is basically threefold. One is kind of the information that officers need to actually address payments or facilitate payment processing in their area that day. where they're lagging behind, which is called delayed musters, and then overall how they're doing. And then beyond that, they can click on what's called these cards, and they get information about the individuals that are actually responsible for the payment, the step in the payment process that is pending, and they can actually call or WhatsApp this individual and say, look, you have a problem, you need to address this. Hopefully that's clear. So we have 2 randomized control trials that come out of the EDI funding, which has been great. One is ongoing and one will be developed shortly. So the first one, we randomize it at the district level, and we're working across 2 states in India, Madhya Pradesh and Jharkhand. And we have a control area where they receive status quo information on payment processing. So one thing I want to point out is we're not actually giving anyone new information. We're just helping, we're reducing the cost of actually accessing that information through the app that provides this information that's in real time onto their phones. In 16 districts, we provide information only to the more senior kind of principal level person, the district officer. In 17 districts, we provide it at the supervisor level, the block, so they're actually still overseeing the agent who's in the field and actually supposed to be processing the payments. And then in another 20 districts, we provide information about the senior and the junior level for this payment information. And I'll show you quick results from that in just a minute, but I want to point out our second RCT that we're planning on developing with the EDI funds, and that is where we'll be randomizing rollout of payment processing information, probably not in the same way that we're doing it for this more senior level intervention, but we'll be providing it to lower level elected officials. And our initial plan that we proposed was to cross-randomize the intervention to 500 different gram panchayats, which are localities, across 8 districts, and this is cross-randomized within our existing intervention. And I was told to highlight the linkages here, so I think one thing that we highlighted is just that the scale of the intervention that we're doing is quite large, and we're actually working across 2 different states, hopefully adding the third, Bihar, which has much worse payment processing issues than either of the 2 states that we're working in. And the payment process does differ across states, so it's interesting to see whether we're seeing similar or different results across the states that we're working in. Our data collection and measurement strategy, we obviously use administrative data where we look at the time to payment, which looking primarily at the mean, but also the absolute average deviation. And just to note that the data that we're using from here is based on time-stamped information that's available in the management information system. So no one can actually tamper with this information. Once you complete a step in the process, then it's in there forever, and we use that information to calculate times to payment. Another thing we look at are programmatic outcomes. So we want to understand not only how does time to payment vary with access to this information, but also how much do people request and work on the program, and how much money is actually spent on it as well. We ran a baseline survey with all district and block level officials affiliated with this program across 2 states in India, which is I think that survey data is really rich and fun to look at in and of itself, so I'm looking forward to diving into more of that. We collected information on demographics, work and management practices, their understanding of the program already, knowledge of delays, organizational performance, things like vacancies, how many vacancies are present in different parts of the administration, their work practices. Then we do a bunch related to kind of these behavioral issues, so reciprocity, propensity towards corruption, public service motivation, Big 5, Raven's test, communication, and even networks. So how frequently are you in touch with officers at these different levels? That's something we haven't been able to dive into yet, but we're looking forward to kind of understanding the linkages across different levels of the bureaucracy and how individuals relate to one another. And then finally, we also collect information from the app that we built with the ministry. So we're able to see every time someone opens the app, uses it, we can see when they call someone to actually say, or they follow up on a message that's in the app saying, you need to address a payment delay in your region and so on, which is interesting. One thing that we'll be doing soon is trying to just use this baseline survey data to understand, can we predict who high users of this type of information are versus those that aren't using it heavily. And linkages here, we're happy to share survey questions and are interested in others that are collecting kind of similar information. And I think the more we can learn about the bureaucracy, I think the happier I'll be personally. But and then one other thing that we're thinking about in terms of data collection later on is how to collect information about officers' time use and thinking about productivity, per unit of time. So and related to the outcomes that they actually achieve. So if others have been thinking about this, I'd be really curious to hear more and get input related to that. So our early results from the RCT that is already in the field is that in areas that have below median time to payment, so they're not areas with high delays at the outset, we're not seeing any form of treatment effects of the app itself. In areas that had above median payment time prior to our baseline, in the year prior to our baseline, we do see in all treatment arms that there's a decline in payment delays just by providing this information. I don't show it here, but it's actually really fascinating because officers are not using the app all that much. On average, the most active group use it about 20 minutes a month. So if you imagine that 20 minutes a month on average is leading to these declines and delays, which are relatively significant across all these areas that have these higher delays at the outset, that's pretty exciting, I think, and interesting how well they're able to decrease delays with just quick app usage once a month. And we also see that we don't find complementarities across kind of providing this information at the upper and lower levels, which is interesting because we expected that we would see that, and we can't reject any differences across kind of providing it at the upper level or the mid-tier level or at both of those levels. And I think that's very interesting in and of itself because providing information at this lower level is actually quite resource intensive. So, this is something we'll dive into a little bit more as we move ahead to try to understand what makes sense in terms of cost effectiveness or something like this. So early results, challenges, and next steps. Delays in funding have been difficult for us so far for the project because we have an ongoing RCT and are waiting on 2 of our grants to start disbursement. So one of the challenges with that, of course, is that this is difficult for relationship management. I think some of our government counterparts sometimes wonder why we're in and out or don't show up as much as we should. And we also have little data issues that we have to address, and it's difficult to do that without having support for that. And then, of course, the RCT to design and roll out. So I think that's it. I mean, we'd love to get feedback, I think, in general on our second intervention, or in particular on our second intervention, because we think there's a lot of scope right now to think through what's the right design for that, but I'm also happy to take feedback or comments on anything that we've worked on so far. Thanks.
I was curious about the average effects you show. Have you looked at any of the quantiles, how much of that is everybody getting paid a little bit sooner versus the really, really crazy 3 months to get paid or being reduced?
Yeah, no, we haven't. That's a good point. So we've done a lot related to basically over treatment by month type stuff, and so we're seeing kind of persistent declines over time, but we haven't actually looked at quantiles. That's a great idea, and I think we should definitely do that soon. And my sense would be just my intuition is probably that that's really important because there are such extreme outliers in this. Yeah.
Presumably you're tracking app usage against which payments then get sped up, because I was just wondering about how much is the effect just simply by the app's existence and this engagement, you're putting it front of mind.
Right.
It's not actually the fact that they log into the app that makes the difference. This packet's already been brought up.
Yeah, no, that's a good point. So we did actually, we had this fortuitous situation where our APIs went down. The ministry had to pull everything for about 3 months because of this Aadhaar data breach that happened in India, and they had to vet everything. And during that time, the app was still there, but the information was not real time, and our effects totally dissipated. So we do think, and they came back on once the information was coming in again. So we do think it's the information itself that's really important to processing. That's, I think, a great point, though. Okay.
How much do you know about the relationship between the higher and lower level official? It seems like there's a lot happening potentially in that dyad.
Yeah, no, I think that's a great point. How much do we know about it? So we will know more from the survey data. We know a lot kind of qualitatively just because we've spent a ton of time in the field trying to develop these, our instruments, but also the app. And of course, India is very hierarchical. So I think if we can say anything about it, it's that part of the reason maybe the supervisor or the highest level official being important is just because everyone, this is the boss, the big boss, and you need to listen to this person if they were to follow up on something. But I think
possibly a lot of heterogeneity in how well they work together, how much.
Yeah, exactly. So that was. So, Saad Gulsar has this interesting paper looking at the bureaucratic political nexus in India, and when, a bureaucrat is reporting into multiple political authorities, and I think, I think there's more that could be done related to the block and the district relationship, and we haven't done much with it yet, but I agree that that's a really interesting point, and I think it also is important for this lower level intervention that we're thinking about with the politics as well, because you can imagine scenarios where the local bureaucrat who's actually implementing the program, who we're considering the agent right now, there could be and I've seen this a lot in the field, there are definitely cases where people don't work well together with the local politician, and other cases where they do work really well together, and understanding when and why that happens could be useful.